Well, welcome everybody to week 2 of our March online program for the alumni of the Sunshine Coast Health Center up in Powell River, British Columbia. And our topic for March is addiction mainly a matter of biology or is it not? Or another way of looking at that, this is the whole disease model debate. Is addiction a disease or is it not a disease, right? Okay, and so what we're going to do this month is I'm just going to present you with some of the expert opinion and allow you to make your own decision, okay? So this week we're going to deal with the guy who's probably the most famous living medical doctor in the field, although he has not practiced in the addiction field for a decade or so. But for years he was, and that's George Vaillant of Harvard University. And Dr. Vaillant is actually a psychiatrist, but, that's a medical doctor anyways. Anyway, he's quite famous for some of the studies he did on alcoholism. In fact, he even wrote one of the most famous books ever on alcoholism called, I've got it right here, right? The Natural History of Alcoholism Revisited, 1995. Anyway, this book is really kind of fascinating because he takes on the whole disease problem right up front. And he says he personally is not convinced it is a disease. And the reason he says that is because he says, frankly, we don't even know what a disease is. We keep changing our mind, right? We used to think heart disease was a disease, and now we're getting some evidence that, well, maybe it's not a disease, maybe it's just like a lifestyle choice. Anyway, now Dr. Vaillant is quite convinced that there's a biological basis to alcoholism. Don't get that wrong. But, what is it exactly? So he is such a big expert. He actually knows all the theories, and he's read all the research and done a lot of research himself. So he questions whether or not it really is a disease. But on the other hand, he does consider it a medical problem. But on the other hand, he says, well, in fact, sometimes maybe it's better to be treated by psychologists rather than medical doctors. Except for maybe the withdrawal part, then we need the medical doctors. But it's actually, he's one of the great experts in the field, and and if you get a chance to read this book, it's pretty good. It's kind of scientific, but yeah, whatever. Anyway, Vaillant makes this point that the reason he will call a disease, alcoholism a disease in public, is basically because he figures that if he can help people understand that they have an illness, maybe similar to diabetes or heart disease or something like that, they will be more likely to ask for help. And the other thing for the public, for your families, right? If they can understand that it's a medical condition, then they're much less likely to, consider you an irresponsible layabout or someone who has criminal tendencies or, whatever's going on in the mind. In other words, there is a physical basis to the brain. So he's quite open in public calling it a disease. But he was in 2006, he came to our conference on addiction and meaning in life, and he talked quite openly about, what addiction is, where it hits in the body and in the brain, and yeah, it was quite interesting. But again, so here's a medical doctor who's an expert, and telling us, for example, that 50% of the professors of medicine, the people who teach medical doctors how to be medical doctors, who are experts in the field, don't consider it a disease. So he's very upfront saying, look, there's a huge debate. But his own personal opinion is maybe we should consider it a medical condition because we know there's this physical basis in the brain. Okay? So that's George Vaillant. So you're probably more confused than ever, so that's good. The point of the exercise is just to give you this information from one of the great medical doctors of the 20th century in the field of addiction, that he does consider it primarily a medical problem. And he will call it a disease, okay? So primarily biological. So that's sort of on the pro side of the disease or the biology debate. And next week we'll give you another expert, but this time not an MD, but a PhD who is an expert in what we call neuroscience or brain science. Okay, just to give you some more information. Anyway, we'll see you next week.